kind invitation to take part in All Indian Ophthalmological Society conference. And today I'd like to talk about our own experience in the navigated laser treatment of most common macular pathology in patients with young middle age central serous chorioretinopathy. It's well known that CSC is a disease of the central zone of the retina characterized by detachment of the narrow sensory retina, which is accompanied by a defect of detachment of pigment retinal epithelium. It should be noted that the key features of CSC as follows: the possibility of spontaneous resolution, high recurrence rate of narrow sensory retinal detachment, and frequent localization in the foveal avascular zone. So, the current requirements for the treatment of this disease is high efficiency with minimal risk of side effects, inherent in laser coagulation in a continuous mode. Therefore, nowadays, micropulse laser treatment being considered as the safest and effective treatment option for the treatment of this pathology. For the first time in 1992, Professor Johann Reuter and John Ben Gruber found that the use of ultra-short laser pulses of high power leads to a selective effect of RPE cells. The selectivity means the ability of selective exposure, that is a small ratio of the impact measure in the target zone to the surrounding. As an example of the different selectivity, consider the following graphs. At the left, with low energy laser coagulation, the temperature profile extends to the adjacent tissues, so selectivity is lower. And at the right, with a micropulse effect, a dominant level of heating occurs in the area of the RPE, so selectivity is high. In the treatment of CSC, the achievement of high selectivity is a very important point. So, usually laser application applied close to each other, completely covering the defects and RPE detachment. One of the main problems of CSC treatment is that it's often difficult to visualize the localization of the point of leakage by ophthalmoscopy. It's possible to see high detachment of RPE, then an RPE detachment of small dimensions, or a local RPE defect. So local RPE defect can hardly be seen ophthalmoscopically. Therefore, the doctor during the operation has to look at the picture of fluorescein angiography, focusing on the vessels, find the leaking point on the fundus, and then approximately in this place act with a laser. The problems of using micropulse mode in CSC treatment associated with, first of all, micropulse laser spots are not visualized during the procedure. And second, it's difficult to select optimal energy parameter for the treatment. How we overcome these problems? We applied a personalized approach in the treatment of CSC, which include a targeted impact on the RPE defects and detachment corresponding to the point of leakage without affecting the adjacent area and tissues. Definitions and application of minimal energy parameters of the microsecond pulse mode for each patient sufficient to achieve the required clinical effect. In this regard, we use of the navigation technology laser treatment implemented on the Nevilas laser system equipped with a micropulse mode allows us to develop individual treatment plan based on the digital fundus image and the data of multimodal diagnostics. This device allows us to import diagnostic data, images from external sources, overlay them with the color photographs of the fundus. After that, a treatment plan is created by applying laser spots on the points of leakage. Additionally, caution zones installed to avoid laser radiation entering certain fundus structures, as well as for better auto-tracking system operation. This slide shows the creation of a plan after applying OCT in in-phase mode to a color photograph on the fundus. Then preoperative planning using the example of a chronic CSC. If on conventional laser, it's rather difficult to treat and not to miss RPE defects, then on the nevellous navigation system, all points of leakage are projected onto the fundus and are accurately covered with laser application. The next key point is the selection of optical parameter. As can be seen from the micropulse regime, technical characteristics, the range of parameters offered by the producers is wide and it's rather difficult to choose the appropriate treatment mode. It should be noted that the range of effective and selective influence on the RPE is in a narrow window of parameters and depends on the setting of the laser system and the individual characteristics of the patient. Therefore, individual selection of parameters was carried out in several consecutive stages. For this purpose, we carried out computer simulation, then creation and individual planning and testing depending on the degree of pigmentation and transparency of the optical media of the patient. In computer simulation, the temperature distribution in the tissue of the chororetinal complex and the level of protein denaturation were evaluated. As a result, we determined the energy parameters of the micropulse with a selective and effective influence on the RPE, taking into account the technical characteristics of nevellous system and depending on the degree of pigmentation and transparency of the optical media. So an individual test plan was created and 3 applications with different power levels were applied to the intact retina in the upper-lower vascular arcade. After testing, we conducted a study of shortwave autofluorescent and selected application with minimal power causing the damage of RPE. Then these parameters used for treatment. This slide shows the test results of patients with different ages. So in a patient with 39 years old, optical media is transparent. The majority of applied spots are visualized. And in the 57 years old patient with a slight opacity of optical media, only laser spots with high power are visualized. This slide presents a laser treatment protocol with individually selected parameters in a patient with chronic recurrent CSC. Next, I'd like to show you the most demonstrative clinical case. The first clinical case, the patient's 31 years old man with CSC with symptom duration of 3 months. According to the first chain geography, point of leakage are visualized with localization in the foveal avascular zone. Before treatment, angiograms were imported into the laser system, combined with a color photograph of the fundus, created a plan and treated with individually selected parameters. Let us consider in more detail how the selection of parameters of the microsecond pulse was carried out. First, an individual test plan was created, taking into account the degree of pigmentation and transparency on optical media. Then plan and protocol. The plan and protocol you can see on this slide. Then the autofluorescent examination was performed and the visible application applied with minimal power selected and they were used directly for treatment. On this slide you can see the dynamics of subretinal fluid resorption and the increase of retinal photosensitivity in patients after treatment. After 3 months, the subretinal fluid completely resorbed and retinal photosensitivity increased. The next clinical case in patients CSC with 2 months duration with a rather high local RPE detachment to which we performed testing and treatment. Laser applications were placed on the RPE detachment area according to the test results, which were recorded in the treatment protocol. After 1 month, the RPE detachment laid down completely. The slit-like detachment of the neuroepithelium remained, and after 3 months, the neurosensory retina is completely adjacent to the choroid. Retinal sensitivity increased. After 3 months, visible changes in chorioretinal complex are absent in the treatment zone and testing according to autofluorescence and fluorescein angiography. And the last clinical case, 57 years old woman with symptom duration 5 months, high visual acuity, carried out planning and treatment according to OCT data in the in-phase mode. Power also selected individually, and as a result, after 1 month, the complete adherence of neurosensory retina was achieved with resorption of subretinal fluid accompanied by an increase in visual acuity and photosensitivity. Thus, in conclusion, based on our clinical experience, we consider that the use of navigation technology based of multimodal diagnostic data in combination with individual selection of energy parameters in the micropulse mode allows for a personalized approach to the treatment of patients with CSC. This ensures a strict topographical orientation and high selectivity of exposure to RPE defects and detachment without affecting the surrounding tissues, with minimal parameters sufficient to achieve a required clinical effect. Thank you for your kind attention.